Good afternoon, everyone. On behalf of Westford University College, I thank all of you for attending this webinar. My name is Tausif Mullah, and I'll be your moderator for today's webinar. As governments make significant interventions in response to the coronavirus, business are rapidly adjusting to the changing needs of the people, their customers, their suppliers, while navigating the financial and operational challenges. With every industry, function, and geography affected, the more amount of potential change to think through can be daunting. For this reason, we have organized today's webinar that will focus on the paradigm shift in healthcare post COVID-19. In current times, probably the most asked question by healthcare professionals is, how is the healthcare industry going to change post COVID-19? Now, this is an important question. To throw some light on this pressing concern, we have two eminent personalities with us today who will share their thoughts on the paradigm shift in the healthcare post COVID-19 and also answer your questions on the same. Allow me to introduce our first guest speaker for today's webinar, Dr. Jazla Fadda. Dr. Jazla is a prominent public health specialist with many credentials at national, regional, and international levels. In addition to her education in dentistry, she got a master's degree in public health from University of Liverpool, UK. Besides her work in management positions for different public and healthcare programs at the Ministry of Health, Dr. Jazla had made a remarkable contribution to the academic profession. She has a wide experience in teaching as a faculty member for graduate students in public health, health systems management, hospitals management, and health economics at the Center for Strategic Health Studies, affiliated with UK Liverpool of Tropical Medicines in her home country. Dr. Fadda has also worked with WHO as a consultant for developing global program for urban health equity. In addition to this, she has also worked with Global Health Workforce Alliance for mapping priority countries facing critical shortages of human resource for health. Dr. Jazla continued her passion in academic discipline by joining the College of Business Administration of the American University in the Emirates of Dubai as the head of Hospital and Healthcare Management Specialization. Dr. Fadda is also associated with Westford University College as an adjunct faculty, teaching healthcare operation management for MBA and Post Graduate Diploma in Healthcare Management Leadership Program. Apart from academics, Dr. Jazla is proactively engaged in media, presenting a variety of healthcare topics on different TV channels such as NBC, Sky News Arabia, Dubai TV, and Sharjah TV. In this webinar, we look forward to hearing her thoughts on today's topic. I invite Dr. Jazla. Very good afternoon to Dr. Jazla. Thanks for accepting our invitation.
Yes. So first of all, let me just have to greet our audience. Good afternoon. Today I will be with you to present what will happen, how we should be prepared post COVID-19. So I will talk in general about what are the challenges we are facing at the moment. What are the challenges we have to think about it in order to start planning ourselves, planning our facilities, our healthcare system to overcome the next step after COVID-19. So I will try to speak first in general, and then I will focus on the initiatives of United Arab Emirates. So what are the ongoing initiatives and in all aspects of the research or the training or even for the treatments. So let me start first. Talking about the how life will change post COVID-19 from medical point of view. All of us will expect that really life will not be the same. Many things will be changing. The introducing of technologies. Now you can see how we are holding our seminars, forums, conferences, everything will be maybe shifted to be online. But let me focus more on the medical point of view. What's happening now? Now, and what we are also expecting that post-COVID-19 will happen. First of all, really, we are all concerned about healthcare workers. Healthcare workers, they are facing now at the moment the anxiety knowing that they are at risk of having the virus or getting infected. So this is very challenging for them. We will see those, we will call them frontliners, those brave people, those our army in the front line on our war with COVID-19. We will see that they will experience, and they started to experience this actually, the post-traumatic stress disorder. Also, of course, they are enduring at the moment extreme work conditions, sacrifices. They are sacrificing their health, they are sacrificing their time. They are, even though they are facing the shortage in PPEs, in personal protective equipments, and this is really challenging for them. Now, what this COVID-19 reveals for healthcare systems in the world, actually, can we see that healthcare systems were really prepared to face this pandemic? Actually, really, it's very sad to say that this COVID-19 highlighted the shortcomings of healthcare system worldwide, and we can see that all the hospitals are overburdened with this with the number of patients, and they need to re-look at their infrastructures. They need the basics infrastructures and also at their processes. This will be the next step that we need to think about it from now. And of course, we need to think about the safe environments. The safe environment, we are talking about the educational and preventional measures which are overtaking or over the world, but we have to focus on the safe environment within the healthcare facilities, for the safety of the patients and the safety of the staff as well. Of course, we need to be prepared. We need to have also better, and I will introduce you by the end of this session about what are the main points as our preparedness agenda, preparedness plan that we have to start thinking about it. And of course, we can see that in Germany, one of the European countries that which is facing the rapid prevalence of the COVID-19, but at the end of the day, their number of deaths are very low. Why? Because they really they show that their good intensive care and the infrastructure in the healthcare system support them to overcome the consequences of this COVID-19 with better response. And of course, digital health, artificial intelligence did really show the capacity, the competency of dealing with this crisis. I will try to show or to answer your questions by the end of this, because I have only very few minutes, short time just to cover all the points. So as we said, we need to know what are the certain aspects of healthcare that should be changed post COVID-19. Of course, we need to stress on the need of implementation of all the let me yeah. We need to stress on the implementation of the good processes, of the good settings and infrastructure of healthcare facility. We need also to see how we can give a lot of the pandemic that's happening. We need to focus in general on artificial intelligence. Artificial intelligence, AI, is our promising change that will make a change in post-COVID-19 to better situation and better control on this pandemic. And of course, it can help the hospitals to manage their resources. It can help also to rapidly reach out the vaccine. You know that vaccines and treatments before, they were taking a long time to be addressed to be tested or to be agreed to be used. But with artificial intelligence, there will be a promising, let's say, rapid and fast procedures to speed up. Now, at the end of the day, all of us are panic when we were gonna finish this situation, when we will get back to our normal life. We will get back to our normal life. This is our questions. At the end of the day, we will reach the end of this channel, and we will get out of COVID-19. However, our life, we are not expecting that our life will be the same. Okay. However, of course, we need to be prepared. We need to take some procedures, some measures that will help us to overcome and experience any other, let's say, pandemic or emergency. By the way, just let me now get into the GCC and United Arab Emirates. Of course, this pandemic affects a lot, dropping of many kind of other, let's say, healthcare treatments or healthcare procedures. There is here, I just want to share with you some figures that primary healthcare was dropped for 70%, secondary care for 50%, dental care for 95%, mental health care for 45%, and allied health for 65%. That will lead us to think about we need to invest in the shift of care at home, on the telemedicine, on the distant care, because we can provide this pandemic, by the way, the good things that reveals by this pandemic, that it can show us that we can do it online, we can do it with telemedicine. And by the way, also I want to share with you that for this question, can remote care be a part of the normal care delivery process now and in the future? Yes. With hospitals, we can say 60%. With primary care, 60%, light care, let's say 40%, mental health 40%. Of course, dental care, we need to have the physical existence. However, the video calls, the telemedicine, the monitoring of chronic ill patients, the treatments, or as a part of telemedicine, all this will be available by this remote care of health, of providing healthcare treatments or even the diagnosis. So also, we need to think about this artificial intelligence, the technologies to limit care avoidance at vulnerable patient groups. Now we have elders, they are avoiding to go to healthcare facilities. We have people with some critical situations. We don't want also to put those people at risk. We want also to encourage those people to be involved and to get their treatment they need, because also we don't want to expand the risk of having more patients in coronavirus or other conditions. So that's why we need to think about using this digital alternatives. But also we need to encourage those people, because you know that some elders, they don't like or they are not familiar with this digital life. So we need to think about how to engage them. Now, let me go to focus on the situation in United Arab Emirates. Actually, in United Arab Emirates, we have now the latest number is 16,793 infected people, and we have a very low death rate or death figure, which is 174, and we have 3,837 people who are really recovered. So as you see, the upper line, those are the number of the cases, okay, diagnosed, and this is very optimistic that the number of recovered, it's getting higher and higher. And we have constants. We don't have any raise in the number of the deaths. It's still in constant situation along with the critical cases. But why how UAE responded to coronavirus? Actually, the first thing and the first focus was on the tests, okay, on the testing, the surveillance, and the surveillance. UAE really, it was in the front line in testing worldwide. And so far, if we just make it comparatively with the number of populations, the size of UAE population, with the 9.5 of population, million of population, we have 1.2 million tests have been done, and this coverage of more than 10%. Of course, this rise, we still have numbers, we still have cases diagnosed, but those cases are not reflecting that that we have the spread of the virus is just getting more and more. No, this is because of the more testing. And as recommended by WHO, of course, as much as more tests you have, as more transparent you will be in getting the real number, because we need to have the real number. And this kind of strategy by UAE, really it shows its effectiveness in getting more transparent number in detecting the cases. And this was, of course, recommended by World Health Organization. Another initiative by UAE was Husn UAE, which is application, can help a lot in alerting the users if they apply this. It can alerting them to if they have any close contact with a person that tested already with coronavirus, and also it will be a benefit of staying home strategy in order to mitigate the spread of this virus. Of course, UAE also was in the front line of providing the humanitarian assistance during COVID-19, and we witnessed lots of medical supplies that fly to Italy, Kazakhstan, and Colombia, Ukraine, and others. And also, we find that it was supported by the business community in UAE. So Emirates Airline and Etihad also, they have really lots of efforts to keep critical commercial goods for like pharmaceuticals and medical devices moving in and to the country. Another thing related to training. What was the initiative of training in United Arab Emirates? Yes, I think I have a few minutes. I don't want to, yeah. So also United Arab Emirates have pioneered experience in having the training of its professionals, healthcare professionals, with having these initiatives. We know that in United Arab Emirates, we have CME, which is continuous medical education. It's obligatory for each healthcare professionals in order to renew the license. So within COVID-19, DHA, Dubai Health Authority, launched continuous CME or continuing medical education online. Before it was only 30% eligible, or it's applicable to have a CME, but now it's 100% online and free, which will be provided to healthcare professionals who should be in touch with the all updates, and they will not lose the opportunities, and in order also to keep them safe. What about the research? Actually, also the pioneered research led by United Arab Emirates was examining the wastewater for as a clue for COVID-19, and this really this initiative, this research, which was conducted by Khalifa University, it showed that really it's very important indication of how widespread the virus in the community. This is very important. So they focus on this research to see the levels of the virus found in the wastewater. This was done by Khalifa University. Now, you all heard about also the plasma treatments, which was also used, which is being used as supportive treatments with the protocols provided with this to treat the patients to combat this virus. And the plasma therapy, it's not vaccine, it's not the only treatments. It's only provided for those who are in the critical situation, and the donor should be completely recovered from this virus, and also they should have the antibodies in their cells. And now let me just show you the videos of the great achievements really just attained by UAE regarding using the stem cells in treating the patients. We are proud to really to have this in United Arab Emirates. So, as we said, that this is not the treatments in particular for this virus, but this supportive treatments really showed very effective and efficacy on the recovery of patients. And all the patients who are provided with this were really totally recovered. They get the patents for this from Minister of Economy. And as we said, also there are more efforts to have more trials to demonstrate the efficacy of the treatments. It's ongoing and expected also to be completed in the couple of upcoming weeks. Another things, as we said, this is supportive treatments. This is provided with or alongside with another conventional medical interventions, and it will be continue to be applied as supportive treatments for the patients. Dubai Health Authority (DHA) also provided guidelines for the management for COVID-19 infection in all healthcare facility, and everyone should comply with that. Another thing, also, Abu Dhabi launched a new portal for those healthcare professionals who want to volunteer. This will make it easier for them to join and volunteer to support the support in fighting coronavirus within the hospital. And this portal was really helped a lot. Now, in artificial intelligence, and I can see many questions, actually very interesting questions addressed by the audience about artificial intelligence and the role of artificial intelligence, how artificial intelligence, AI, will really make a change. Actually, in UAE joined the international community in celebrating World Creativity and Innovation Day, WCID, and it was in 21st of April, and it's really raised the awareness about the importance of creativity and innovations in this stage in fighting in our war with COVID-19. Okay, so we need, and in line with this, also UAE is proud to launch a new massive lab in order to test COVID-19. I think many of you heard about the leading technology company based in Abu Dhabi, which really launched a new massive throughput laboratory, which was created within 2 weeks, and it's it has a large capacity to doing let's say 10 of thousands of tests per day, and this will of course help a lot in doing the surveillance and more tests in order to contain this pandemic. We need to think about the opportunities. We need to think about the innovations and the technology in this crisis. Telemedicine is not new. It was launched in United Arab Emirates since 2014. However, now there is a MOU between Ministry of Health and between Telecom regarding a full virtual hospital. Full virtual hospital will provide care for the patients, and this now on the ongoing of establishments. It's really pioneered and it's new in the region. It will be the first initiative in the region to provide healthcare for the patients, and of course this will minimize the travel cost. By the way, using such technologies will have more effectiveness in terms of and efficiency as well, minimizing the travel cost and all this cost paid by the patients. And at the end of the day, we need to mitigate the exposure of all the patients and staff to the virus. UAE cabinet also plans for country post-COVID-19 future. Sheikh Mohammed bin Rashid, he also give his instructions to begin to plan for the country's post-coronavirus, and he said that we need to have plans to address immediate issue and long-term changes. And of course, the national priorities should be reviewed. The focus will be on the financial, the human resources, on the healthcare, the food and economic security. So food security, economic security, and of course, healthcare. We need to prepare ourselves for post-coronavirus Of course, the next step was by forming teams and task force to start working in this. Sheikh Mohammed bin Rashid said the whole world would need to come up with new ways of working that focus on key sectors, including health, education, technology, and food security. He further said serious changes need to be made in the world post-coronavirus. The reality of work will change and the way of work must change. The world after coronavirus needs different preparations because it will be, of course, different. And now, just quickly, let me just take you to how we can invest in our healthcare system. Healthcare system, as we know, is compiled with 6 blocks. It's the leadership and the governance at the top. It's the healthcare financing of the budget. It's the healthcare workers, the human resource for health. It's the technologies and the medical products. It's the information and research. And then we have the service delivery. So at the end of the day, we need to focus on those blocks. We need to think about it. We need to think how we can expedite this and improve and develop these blocks in order to reach our goals and good responsiveness. We all know that the slogan for World Health Organization this year was "It's nurses and midwives helps in healthcare for healthier." Of course, of healthier life. And we need to support nurses and midwives. This coronavirus, this COVID-19 showed that really we have shortage in nurses, in healthcare providers, and we need to start investing on them. What are the main 5 key investment areas? We have to think about it. First of all, we need to invest in nursing and midwifery education. More graduates from this domain we have to focus on. We need to employ also more specialist nurses, and we need to invest in leadership skills. Leadership skills is very important, and not it's only for the medical staff or for the doctors, for the nurses and the midwives. We need also to make them the heart of primary health care in order to keep delivering and supporting, of course, the children and the maternal health. And we need also to have there the pioneer role in health promotion and disease prevention. And at the end of the day, let me outline or the presentation what is the main preparedness points on the micro level we have to think about it. We need to have facility preparedness agenda. We need to have to early, of course, fit testing, training programs for our staff. We need to think about the waste management. This coronavirus, let me just point on this important point. The waste are really increasing. We need also, of course, we have good impacts on environments from reducing the emissions of carbon dioxide. But at the end of the day, also we have the many wastes, and we need to think about the safe disposal of our waste. Of course, we need to not to panic. We need to calm down our healthcare providers. We need to support them. We need to make them always updated, and we need to be transparent with them with the last update. We need to have monitoring system to respond to all the social media posts, and we need to have the HR policy that keep our staff healthy and safe. So we need to work with authorities. We need to have the clinical guidelines. We need to have also more strengthened patient management guidance to provide for home healthcare providers, shifted to home and investment in home care now and remote care. It will be the most important recommendations we can give. Of course, the artificial intelligence for patient screening, even for the treatment and diagnostic and safety guidelines distribution for the visitors, and all the environmental, internal, indoors safety measurements that should be taken. So at the end of the day, I think I took more than my time. The supply chain is very important. The supply chain is the shortage and the shortcoming that revealed by coronavirus. Supply chain system should be also assured, should be strengthened and monitored directly in order to respond to the post Covid-19 and any expected post outbreak or pandemic that might happen. Thank you so much, and thank you so much for your listening. And we will, by the end of this session, we will respond to all your questions. Thank you so much.
Thank you, Dr. Jazla. That was very informative. And as I can see, some of the comments that, our audience were, really getting informative information from your presentation. So I really appreciate that. Thank you again. Now we'll move with our next speaker, Dr. Mila Dimitrova. Dr. Mila is originally from Bulgaria. She's currently an associate professor at the Medical University of Varna, Bulgaria, in the Department of Healthcare Management and Economics. She teaches in several universities around the world: Medical University of Varna, Varna Free University, Technical University of Varna in Bulgaria, CASS Institute in France, Ghana Technical University College in Accra, to name a few. Dr. Mila is also an adjunct faculty with Westford University College, teaching healthcare courses. Her professional career includes both academic developments and work with healthcare organizations for over 20 years. Her research interests include hospital management, performance measurement and management, healthcare project management, healthcare management diagnostics and analysis. Currently, she's working on several research projects, including the future of healthcare management and a framework for the analysis of national healthcare system. I welcome Dr. Mila for the webinar.
Hello, Tosif. Do you hear me?
Oh, yes. It's loud and clear, and we can see you clearly. So the screen would be yours. I'll go on mute. I'll go off screen, and you can start your presentation.
Okay, I will open the presentation now. Nice to be here, and I will turn off the camera now, but I will leave the microphone on so you can hear my voice. First, good day to all the participants in today's webinar. It is a very challenging time, and it's good that we can be together and discuss what it is about, what can we do about it, and how the humankind will proceed in the future. The previous lecture was very interesting, full of interesting and important details, a lot of statistical data and visual elements. So I'm glad that you liked it. I saw the comments in the chats. And this is not surprising because Dr. Fadda is an exceptional professionalist. So I will continue with the lecture now that I have prepared in first place. And I would like to start with a short history lesson that I had a very long time ago. We had a wonderful history teacher, and she was telling us about how the human civilization development is going on through the ages. She explained to us that there is a cyclic order in human civilization development. And what she told us was that hard times create strong people, and strong people create good times. And then good times create weak people, and weak people create hard times. Well, it is a citation from a science fiction book. Probably some of you know it already. Maybe you have read it in the past. But history is important because we can learn lessons from it. And throughout history, as humans spread across the world, infectious diseases have been a constant companion. So even in this modern era, outbreaks are nearly constant. So here on this slide, you can see some of the history's most deadly pandemics, from the Antonine plague to novel coronavirus. And what is more interesting is that actually the death toll was different from the different pandemics through the ages. COVID-19 was officially announced as pandemic according to the World Health Organization on 11th of March 2020. And for those of you who are interested, what is the difference between epidemics and pandemics? Here, I decided to put this slide just to help you make the difference and to understand that actually epidemic could be an event in which a disease is actively spreading. Often it's used to describe a problem that has grown out of control in a specific region or city or small country sometimes. But when we talk about pandemic, this is almost the same event, but now related to geographical spread and with disease that affects a whole country or many countries or the whole entire world, just like now we have the problem with coronavirus. So according to World Health Organization, pandemic is a situation when we have between 3 and 5 billion people registered as serious cases in flu infection and between 290,000 and 650,000 respiratory death cases due to flu infection. This standard definition of the World Health Organization. And because we know that statistics is the grammar of science, well, we will check some of the statistical data that is important here. So the world on 9th of May 2020 is interesting. Well, we have more than 3 billion people, 3 billion cases of COVID-19 reported, of course, depending on the different strategies in the different countries. And you see the deaths that we have. So this is around 7% mortality rate. And also the situation in Europe on 8th of May, or until 8th of May, because we are talking here about the period of time between December and May, we have more than almost 1.5 million cases and 148,000 deaths approximately. So it's around 10% mortality rate according to the European Center for Disease Prevention. You can see the map of all the countries that have been affected by coronavirus. So you can see the circles inside. The bigger the circle, the more the cases and sometimes more the deaths that we experience here in Europe. For those of you who likes numbers, well, you can see some of the cases reported in Europe by countries. It is in the red font. And you can see and you can make actually a comparison with the rest of the world, having all the others like Africa, Asia, America, and so on. The same way goes for the deaths that have been reported. So next one is an important notice that I want to make here. Well, it is good to know about statistics, but you should know something more about statistics. And this is it, that facts are stubborn, but statistics are more pliable. This is what Mark Twain said, and this is absolutely true. So what are actually the real facts behind the statistics? Well, we know that 14 million people are expected to die in the first several months of 2020 from different causes. So we are expecting 263,000 people to die from, actually we have already, not expecting, sorry, we have already 263,000 people died from COVID-19, which makes the mortality rate about 1% in 88. And this is all the fact. So going back to the history lesson, that hard times are leading or could lead to good times sometimes. Well, any pandemic no matter what the percentages are, is terrible and with unpredictable consequences. But it is also an opportunity to restart, rethink, innovate, and focus on important things, because this is how the evolution works. So, what have changed in Europe for 50 days? Well, we have tens of thousands of organizations that have found a remote or home office can work, and hundreds of thousands of people have proven they can work from home. New channels for that we have, channels for services and products. And for several days, e-learning was organized and introduced in kindergartens, schools, and universities around Europe. Okay, so also countries and companies have offered online options for payments and services, and video conferencing became a daily routine. Food chains bought local goods. Thousands participated in volunteer work, and thousands have donated. And the process for the Eurozone waiting room was accelerated. Books were read 3 to 4 times more. Museums, galleries, and properties offered a virtual tour. And number of free trainings, resources, and services have been released on the network, free of charge. So what has happened, we know. What will happen, we should try to understand or predict. So, as Niels Bohr said, making predictions is very difficult, especially about the future. So, in this respect, I would like to show you that there is a strategy plan for COVID-19, and it is from the World Economic Forum. Here on the left side on the slide, you can see what has happened because of COVID-19. There is a change in the financial markets. The travel, the trade, healthcare, vaccination was influenced. There was a change in the media's role and also the government responses nowadays. Workforce impact was introduced as well, and avoiding the infections and spread as general task for all the countries around the world was introduced. But what is more important is that COVID-19 has changed not only our agenda, but it has changed our values. So now we are starting to pay more attention to the values that we have forgotten in the past, like trust, like human dignity, like common good, like environment, like digital equity. All these are important if we want to survive in these times of trouble. And what about the future of health and healthcare? Well, we will have to try to keep our population healthy. How shall we do that? Depends on the way our healthcare management and healthcare organization is proposed. Healthcare delivery systems, they will need to reorganize. They will need to be managed with more care, managed by professionals, with people with master degree in healthcare management. And healthcare technologies, well, this is something we already have, but this is something we will need to think about more in the future if we want to stay healthy and if we want to keep our population alive. Environmental health and climate change would need more attention in the future because they can influence the environment we live in and our health. Global health governance is another idea that may be good for the future, and to organize the global health initiatives from one point center, from a team of people with deep understanding and management skills in the field of healthcare management. So next one is the healthcare delivery. What about the healthcare delivery? Well, besides the healthcare technology that could help us to improve the healthcare delivery system, we will need to have a better access to care. And we will need to think about our health policy, the way we work with healthcare data and the way we protect it. And also, the human capital in healthcare is something that is important and that we need to think about. And also a promise of precision medicine also that we put our hopes on. So we expect our healthcare delivery system generally to be value-based, not money-based. About the global health, well, we will need global health governance, that's obvious, and data collection and communication should go on another level. There should be more efficiency in doing so. And also, sustainable development and universal coverage is important if we want our world to be healthy and if we want all of our people to be healthy too. Pandemic preparedness and response. Probably you have heard some of the good comments and advices that Dr. Fadda did before me. So yes, we need to be prepared for the future. We need to work together in order to survive together. It's obvious that the earth is one and people must be one too. So no more boundaries around the countries, because as you see, there are no boundaries for epidemics. There are no governments for epidemics. So we have to be focusing on shifting demographics and a lifestyle so we can introduce a healthy lifestyle for all in every country, in every region, for all the people, no matter what is their education, what is their social status, and what is their information that they get about their health. Next one, biotechnologies. Well, biotechnologies are popular in medicine, medical field, in healthcare field, but also what is important is the relationship between medical technologies and environmental technologies, agriculture technologies, industrial technologies. It is important how we use our bio-big data and how we do machine learning, how we treat synthetic biology and gene and genome engineering. All these are important for our future because thanks to them, we can continue to innovate. And innovation is important. We can have innovation systems. We can have government innovation. We have technological innovation, innovation in healthcare, in business models that we have. In social, and nowadays, the innovation must lead to social benefit. So, workforce and employment were impacted by COVID-19. And that's understandable. Well, we will have to think about our labor markets. You know, in Europe, a lot of people have lost their jobs because of COVID quarantine measures, because lots of people had to stay at home and lots of companies decided to fire their employees because it's cheaper this way and the profits are not going down fast. So we will have to think about that, about the future. This is not the solution. It's not solution to fire people. So we'll have to think about new work models. We'll have to think about new creation of a new kind of jobs that don't exist yet. And we will have to be more entrepreneurs in our practice. We'll have to think about the way we train people, about the way we certify them, because social protection is important and labor market depends on the health of the population, but also health of population depends on the labor market and the economy of every country. Next one, education and skills. Well, quality basic education is important. Also, a lifelong learning pathways that we have to think about. And this is all related to education innovation. And also, we have to think about relevant specialized education, especially in the healthcare field and the field of healthcare management. Because healthcare management is what can make our healthcare system better. And when our system is better, our health will be better. And when our health is better, our economies would feel better. So we will need to have more digital fluency. According to statistics, 90% of all the parents want their children to study computer science, but only 45% of the schools are offering it. So you can see what a big gap there is between the needs and between the offered education at the moment. STEM skills, which include science, technology, engineering, and mathematics, are important and should be in the basic learning education as well. So, in general, some final words about the COVID-19 is that actually COVID-19 will lead not only to changing the way we educate, we treat patients, the way we go to work or govern our countries and our organizations, but also it will change humankind. It will enhance human, because thanks to the measures that we will take in the future, we will have enhanced genes, we will have enhanced bodies, enhanced minds, and enhanced longevity. We will have more equity and social justice, and also humanism and autonomy. So all these are positive outcomes from every crisis through the history of the humankind. And they say that for every disease there is a cure, but I would add here, some diseases come as cure for the humankind. And here at the end, I would like to finish with the dialogue between two of the main characters from the movie The Day the Earth Stood Still, with Keanu Reeves. And here a professor from Earth explains to the representative of the extraterrestrial civilization that we are on the brink of distinction, and it's the only moment in time when people find the way and the will to change, because only at the crisis, through the crisis, we evolve. So this is our moment. Thank you.
Thank you, Dr. Mila. Thanks for that outlook of how COVID-19 has impacted and what we see in the near future. Thank you very much for that information. So now what we're going to do is, for our audience, we're going to run through a quick presentation of our MBA program. So this will last for like 10-15 minutes. And meanwhile, I would request everyone to please put your questions in the Q&A section, so that after the presentation, we can take the Q&A and then we'll address there. So I'll just run the presentation. So this presentation will mainly focus on it's more of a virtual tour for all of you to talk about what the MBA program is all about with UCAM. Now, over the years, Westford University College has been in the news for all the right reasons, right? We have got many awards, accolades from different media agencies, and so the most recent one was from Gulf News. This was where they awarded us with the top universities of excellence in the UAE for the year 2019 and 2020. Not just this, but this 2019 was one of the best years for Westford University College, where we had so many awards, like starting with the most prestigious from World Guinness for one of the events that we conducted. And also we got an award from Forbes for Higher Education Awards for 2019. One of the things which every faculty member, every staff member at Westford is proud of is that we are are somehow able to impact the life of a students from 113 nationalities. I have not seen any other institute talk about audiences, but Westford. So that is something that we all feel proud about. Now, in this particular presentation, I'll mainly focus about a new program which is we call as the Triple Crown MBA. Now, the main reason why we call this Triple Crown MBA, which I'm going to explain in a couple of slides, but it's something that you as a healthcare professional, that's something that would be beneficial for you and will give you a lot of advantage in your career. So this Triple Crown MBA mainly comprises of three certifications in one qualification. I repeat, it's three certifications. So mostly you would have heard something related to two certifications at one time, but this is the first time that we're coming up with the program. There are three certifications. First and foremost, this program can last for 12 to 14 months. And the first qualification that you'll be getting from would be from CIQ, that's Cambridge International Qualification. This would be a postgraduate advanced diploma in business. The second one, once you completion of your top up, then you'll be getting an award from MBA or from UCAM Spain. And the third one, with that, the newest addition to this is Certified Healthcare Management Professional Award by CMI UK. CMI is Chartered Management Institute UK. It's one of the most reputed one in the field of management. So this quickly brief introduction I'll put forward for Cambridge International Qualification of this awarding body, which was started with an aim to accredit qualification which meets the ongoing needs of the learners as well as the needs from the corporates. So with this qualification, they're trying to bridge the gap between the academia and the corporate world. So they look into the qualifications awarded by them. Here's a quick introduction for you all for the University of UCAM. So UCAM is a private university which was founded in 1996 with a clear mission to provide quality education for the students and to serve as a society to contribute to further expansion of human knowledge and human capital. UCAM was among the first universities to adapt its program to the European higher education area, following the Bologna process. Now, what is this Bologna process? Bologna process constitutes agreements between European countries to ensure compatibility in standards of quality of higher education. So all the European countries that they have, so if you have to make sure that your qualification matches, so you have to be at par with the Bologna process. UCAM has around 200 renowned international strategic partners, namely, to name a few, we have Berkeley, Stanford, and so on, and Westford University College is also one of these strategic partners for UCAM. UCAM was named as the 10th among the 10th top universities in Europe for 2019. And their campus is considered to be one of the most beautiful campuses in the whole of Europe. So by the image you can see, and you can just check on the internet and on Instagram and so on. So all the images that you will see of university of campus, you'll really be in complete awe of the location and the infrastructure being created. Now we'll quickly touch base upon one of the star certification in this program, which is Certified Healthcare Management Professional (CHMP), which we call as a key differentiator in this MBA program. Someone who completes this program, any participant who completes this program, they'll be awarded of free 1 year memberships from CMI. Now this is an affiliate membership. Not everyone would be getting this membership. So once you complete this course, only then you'll be getting an award from them. Start with an affiliate membership leading to chartered management. So not only your MBA degree, not only the diploma, but also you can showcase your CMI membership through your prospective employers. Okay. Now, when we talk about this CHME program, there's certain things that why it stands out. First, let me touch about this, the things that you'll be getting when we completion of this program. First and foremost, understand a variety of healthcare settings, not just mainly focusing on a hospital context, but different aspects of the healthcare industry. So all the aspects will be covered in this program. Second, you have analyzed the important issues in healthcare management, such as ethics, cost management, quality, audits, procedures, and quality control would be addressed as part of the program. Third, analyze phases in healthcare project management from project initiation all the way to closing. So we'll also considering mainly about the business context of it from the healthcare side, that how do you start a project and how do you find the finance close the project of it. Understand healthcare stakeholder management. As we all know, as we teach in business management that there are 6 stakeholders, right? So we need to understand in healthcare context, who are these 6 stakeholders and what is their how is your organization going to impact on them? So that is something we touch base on this program. Apply strategic planning and implementation. Now, no organization can survive unless until they have a strategic vision and strategic planning in place, right? Even in today's current tough times that we are seeing, the organization that have a very strong vision for the company, they are the ones that are standing tough and facing this current situation. You have use management information system. So in this program, we'll also showcase you how can you use MIS for the beneficial, let be doctors, be it nurses, or be it management professionals. So you'll be showcase about how to make use of MIS for decision making as well. That gives you the second point, which is critical, learn critical decision making. With our program, with our exercise in class activities, we'll make sure that the students get a habit of analyzing things and coming up with critical decision making. And last but not the least, analyze the use of artificial intelligence healthcare management. To this, I'm sure we have already a lot of questions based on this only topic of us. So which I would be requesting later on Dr. Jazla to answer these questions. But this is also covered in this program. So that's why it will make any professional who wants to continue this program stand out from the crowd. Now, what is the structure of this program? The structure would be divided mainly in two parts. So part one is what we call as core modules. So you'll be having 4 modules. So in a span of 4 months, starting with international human resource management, operations management, strategic change management, and last but not the least, strategic management leadership. So these are the core modules which we covered in the span of 4 months. Then you go towards more specialization module. Your specialization modules you have for 2 months. Here you have two: healthcare management leadership, HML, and healthcare operations management. So once you have completed your part one, then you move to the part two, which we call as top up. So your top up would be your MBA degree, right? This will be from UCAM. So you will be having two more of a modules. So you'll have socioeconomic legal environment, and then finally your thesis work, which is going to be a dissertation. So that's what you have in terms of the structure of the program. And the course delivery, if we just quickly touch base upon, you have multiple options. So Westford gives you a lot of flexibility. That's something, is our USP, that we give a lot of flexibility to our professional students who have work experience. So in this case, you can see that we have online, which you can have Sunday and Tuesday at 7:30 p.m. to 10 p.m. the UAE time. We have 4 weeks with 8 sessions per subject. So that will give you ample learning for each module. Subjects and units are assessed through projects and assignments. So we don't have examination, written examination, but purely critical thinking. So you'll be giving projects and assignments to work on. And lastly, you have one resubmission if at all you're not able to clear a certain module. So you get another chance to clear it. So there's always a hope, as we say. That is something you can expect. Course delivery, in the part two, you have individual dissertation guide for the MBA. So you'll be given appointed a guide. With the guide, you can discuss about what will be the flow of the dissertation. You'll have meetings with them, and at a certain point of time, you can even have online meetings with your faculties, your supervisors to clear your doubts. Now, this is something that on slide which we talk about why Westford. Why, if you want to talk about why should someone choose Westford? So this, I'll say, this is something that you should focus on. Firstly, our learning style is very unique. So we not only just restrict our teaching with PowerPoint presentation slides, but we involve a lot of activities, in-class activities, in terms of be it case studies, be it group discussion, brainstorming activities, and so on. We use a lot of multimedia. So in terms of videos, in terms of applications, in terms of whiteboards, and so on. So these are something that we use. And most importantly, the thing that we focus a lot is P2P learning. That's what we call as peer-to-peer learning. So we strongly believe that a student learns a lot from other fellow student. So that's why we make sure that we give a lot of time and emphasis on these things so that the classroom interaction is at par. And how do we assess? So we have multi-layered of assessment. So assessment can be through by case analysis. It can be organization analysis. So you start the assignment, and the first thing you have to do is decide on organization. So based on the assignment brief, you can even decide on what type of organization fits well for that assignment brief. A lot of group tasks are done. So be it an on-site class or be it online class, you will be put in groups and you'll be asked to work on a certain project, and then you have to make the presentation. Then you have also group discussion, and the new thing that we have recently added is the quiz. So we'll do a lot of quiz for interaction in terms of your core subject and in general area. So we cover two aspects: core specific and also the general side of it, which can be accessed by all our students. And in terms of student support, we give a student support. It's a three-tier support. The first support you'll always be getting from your LMS, where you upload your assignments, you can download your presentation and the resource materials. Then you have your course administrators and your course leaders. These would be the single point of contact in the program. These would be single point of contact in any given point of something is not clear. If it's not working for you, you want to, want an extension, any kind of these things, you have to get in touch with your course administrator and course leader. And once you complete the course, then the big day would come for you where you will attend your convocation in UCAM Spain. If you remember just a couple of slides back, I had showed you the amazing, beautiful campus where you can. So you'll get a chance to go to Spain and you will have a convocation over there with the rest of the students. And for any more information that you want with the Triple Crown MBA program, please feel free to call us if you're in the UAE. If you want to drop an email, our email is mentioned, which is info@westford.org.uk. If you have any questions regarding the program, please feel free to drop an email. Our advisors will be more than happy to answer your questions. And on that note, we move now to the Q&A session. And I would request Dr. Jazla and Dr. Mila. So we have already some really good questions which have come forward. So let's quickly talk about the questions. So let me pose the first question over here. Okay, so first question we have was from Zaid. Zaid has asked, does this MBA prepare you for a career in managing and setting up mental health entity in the MENA region alongside renowned doctors in the industry? I would request Dr. Jazla if you can answer this question. How would an MBA program help a professional like him?
Yes. At the end of the day, we talk about, you remember, me and Dr. Mila, we mentioned about how to get prepared for the next step. We need first to think about as a part, healthcare professionals as a part of the healthcare system. Leadership is very important. Such degrees will help you in being leaders and in healthcare facilities. So how to lead healthcare facilities, how to manage healthcare facility equipped with all the information related from A to Z. And at the moment, leadership, it's really a must to be prepared and to strengthen and to rebuild the rigorous healthcare system. So such degrees will help you to be leaders and lead your own facilities. And it will be also leadership on the macro level and micro level. So it will be very important for you, actually. I do recommend it.
Thank you, Dr. Jazla. Next we have, it's again from Zaid. The next question we have is, to your mind, will the shift to online be for long term or is it going to be for a temporary basis due to COVID-19? So Dr. Mila, if you can answer this question. So do you think this shift is going to be temporary basis or long term?
By all means, there would be some changes in the long-term plan and some changes in the short-term plan. It depends on every country government and on the management teams of many organizations, sometimes global organizations, sometimes local. So only the future can tell us what will stay permanently and what will be just for the moment. As we see already, some of the measures are lifted up. So things are getting back to the normal bit by bit, slowly, but still. So as I see it, just some of the measures on strategical level will be permanent. And those related to operations and to short term, maybe they will disappear with time.
Okay.
Yeah.
Thank you, Dr. Mila. The next question we have is from Syed Raza. Syed Raza is asking us that while we shift to telehealth and artificial intelligence in managing patients, does this put patients at increased risk of lack of safety, poor compassion, less satisfaction? What we know about this from patient perspective? That's a very important question. Dr. Jazla, if you can answer this.
At the end of the day, shifting to telemedicines and artificial intelligence and digital health and all this remotely, let's say, tools in order to provide healthcare, it's for the safety of the patients. But the thing that we are worried about is the ethical issue about the confidentiality of the data. This is the most important issue. Actually, UAE, I just introduce you to this Al Husn app that will detect and alarm, make like alarm and alert people for if they are in contact with the patients. It's really came with a high level of privacy and confidentiality using AI and using all the technology. So at the next step, we are expecting that we will use more AI and technology and digital health, but also there are lots of efforts to have the privacy for the patients and confidentiality. This will not be neglected. This will not be affected. But for the safety, at the end of the day, all this it will be for the safety for the patients and will not be vulnerable and exposed to the virus.
Thank you, Dr. Jazla, for the answer. We have another question from Anshu Singh. Anshu wants to know how to bring stem cell into the active form. Dr. Mila, if you can throw some light on this.
Well, this is not my area of expertise, so maybe Dr. Fadda can help
Dr.
us.
Fadda, if you can just throw some
Yes,
light on this.
I didn't understand the question. It's not clear, but see, as I told you, let me about the stem cells. Stem cells, it's using the cells from the body in order to do two things. First of all, to reactivate or regenerate a new cells. Especially, it's used now in COVID-19 for the lungs because you know that the lungs will have lots of it will be destroyed. The cells will be destroyed. So this will make as reactivate of new cells in the lungs, and it will save the lungs and be the let's say reactivate the new cells. The other issue is making control on the, you know, we have the cytokine storm that's coming once the as a immune reaction of the virus of the infection. So this will control all the cytokine storms or the extreme reactions of the immune system, which will make more cells to invade the cell, the lungs and destroy them. So the stem cells will also minimize this reaction of the immunity system, and by this will save the patients, because why patients are dying in the critical or in the ICU and they reach the critical situation because of this two things: destroyments of the cells of the lungs plus the extreme cytokine or the immune system reactions. So stem cells will control them. However, stem cells is not the particular treatments provided in for COVID-19. It's supportive treatments that will save patient's life, but it will not replace the other protocols of the medical treatments provided for COVID-19. It's only supportive. So it's not vaccination, it's not a treatment or the only treatment, it's supportive, but it showed really its efficacy, and still in United Arab Emirates, they provided to 73 patients and all of them, they really recovered. There is no side effects for this, as we saw for the other treatments provided, like the chloroquine and others. They have lots of side effects. For this treatment, there is no side effects, and stem cells now it's the new emerging in the treatments of in medicine. So we would expect this for anti-aging and so many using for treating so many chronic disease. So this is the in brief just to highlight on the stem cell therapy.
Awesome. Okay. Thank you very much, Dr. Jazla. The next question we have is, I think so, Dr. Jazla, you'll have to answer this question because you have covered this topic.
Yeah.
It's from Monzi. Monzi wants to know that if I heard it well about DHA, the online training is for nurses who have already had the license, or it's for all the nurses?
See, usually, as I mentioned, that's continuous medical education or CME. It's obligatory for all healthcare professionals who are licensed and registered already, and they want to renew their license. So they need to, for the doctors, we have 20 hours. For the nurses, we have 40 hours, and for the light, we have also 20 hours. So it's obligatory. Now, before this was allowed to be held online only 30%. Now the initiative is to cover the 100% of the courses of this CME can be covered online by the courses, by a platform prepared by DHA, and is free of charge and now available for the nurses. But the nurses already licensed and already they want to renew their license. Now, of course, we have opportunities for continuous medical education for those nurses who are not registered, but for this platform I talk about, it's for the license already who want to renew. So it will be free of charge platform, and they will have their CME to renew their license.
Thank you, Dr. Jazla. Next we have is from Zaid again. Zaid wants to know that, do you think that ongoing online is beneficial as offline, and can new technologies bridge the gap of any shortcomings from the current paradigm? Dr. Mila, would you like to take this question?
I will read the question again. That going online is beneficial as offline, and can new technologies bridge the gap of any shortcomings for the current paradigm? Interesting question. A very tricky one. Yeah. I like playing with words, and this is one of the cases here. But yes, going online is beneficial, but depends for who. Is it beneficial for patients? What about if they experience technical problems? What about if we experience technical problems with our patients, as I did today in the webinar? What shall we do then? What will happen with our patient? Is he going to die, or is he going to run away from the hospital screaming that he's never going back to that hospital again, no matter how modern this hospital is? Well, going online is good. It's possible. It's useful. But when we talk about human health and human life, there should be more security systems to check and to test everything in advance before we apply it to human health. In these cases, yes, we can go online for exchanging data, for exchanging visuals, and all the information related to patients, for making distant calls and communication with doctors around the world. Yeah, telemedicine is very popular, as Dr. Fadda already mentioned. But going online could have other aspects as well. So in this question, Zayat is putting a bomb inside because he didn't explain what exactly he means. But it could be anything. But I would say, yes, it has its strong points, it has its weak points, and we have to be careful about the weak ones and not going too much aside from the attention to the patient and his life and his health.
Yeah. Yeah,
Thank you.
yeah, I can also,
Yes,
thank you so much, Dr. Mila. Yeah, it's very, very interesting answer. See, at the end of the day, e-health and telehealth, telemedicine, it's not new, as we all know. But at the moments of this pandemic, we are facing public health issue. So we need to talk about that, and we don't know when we will stop, and we don't know if we will have another pandemic or outbreak. We don't know. We are just now in uncertainty, actually. However, now, also, as Dr. Miller said, there is good points and maybe negative points. But the good point that it will save time, it will save cost, it will save lots of things. And we can see, now we need to think about the improvement and developments. Maybe once we start the online classes or the online teaching for the schools, at the beginning, there were some weaknesses, but weeks after weeks, they start to upgrade the system, they start to improve. So the improvements and opportunities for improvements is there. And to have this online courses or online classes or online digital life, it's not that negative things. If we think about the continuous improvement of not facing, for instance, the technological constraints or challenges, all this should be mitigated to make it very effective to have it, because also it will drop out many of things that we can avoid. It's rather it's related to the cost wise or it's related to the safety wise. So this is just my point of view.
So in a way, we can say that it's more of supporting rather than replacement. Am I right?
Yeah, maybe we don't know if we'll have 100%. It's under actually under study, but it's not that bad things. Of course, face-to-face interaction, it will be more effective. But see, now we can see each other, we can talk to each other, we can interact, we can raise questions. So and it will save time of traveling and save time. So it has all some positive points as well. So we have to think about it, but with more improvements about this. But to be permanent online, as Dr. Mila said, it's still unknown for the CME or other courses.
I would add that maybe when there is no other options, yes,
Yeah,
do it.
this would be the best option. Yeah,
Yeah,
of course. Yeah.
and I prefer the human interaction. I think
Yeah, but we don't have another. Now we are under the threats of public health issues. So, and it's really in uncertainty. We don't know when we'll finish this. What is the post COVID-19? We need to be prepared, and this is one tool of us. It's one tool to be prepared for the next stage.
Thank you,
exactly.
Dr. Miller. Thank you, Dr. Jazla, for commenting. We'll take two more questions. We have a question from Olivia Rodriguez. This is continuation to Dr. Jazla, what you've already spoken about regarding the privacy concern with AI. So Olivia is putting a question where she says, how can patient confidentiality be measured when we start using AI and it has a drawbacks with patient data and so on? How can we measure the confidentiality?
See, in confidentiality, and we always talk about healthcare ethics, and the most important thing is data. Data is very important thing once we are talking about confidentiality within healthcare. Now, once we are using AI and those digital health, the confidentiality will be with who will be eligible to have access to this information and to this data. And already we have law about this. So the data, even though and usually the data, the digital health is not new only in COVID-19. We started this long time ago. And once we have data, it's not exposed for everyone and disclosed for everyone. So there is a limitation in people who will be eligible to access this data. And even in healthcare ethics, we talk about even though the sometimes if this data will be shared, of course the patients will be asked for that and for their consent, and we have patient consent and confidentiality, and the data disclosure is a part of patient consent. So there will be no worries about this because at this stage, as we said, we don't have another option. We need to collect data. We need more data because we are now in the era of collecting data. The more data we have, the more accuracy in finding solution we will get. So as a part of collecting data, of course, there will be, as I mentioned again in Al-Husn app. In this app, there's already mentioned that how the confidentiality and privacy for the patients will be all saved for the patients and will be taken care. So it's related to the artificial intelligence will be helper and supporter in this. It will not be against, it will be with, because it will find more ways to have the privacy for and confidentiality for the patients.
Okay, okay, that's a good point. Thank you, Dr. Jazla. I'll just add one question from my end. That will be the last one for today's webinar. So this can be answered either by any one of you, so that's okay. And the question I have is, I was going through a recent interview by Dr. Azad Mupen, the founder and the chairman of Aster Group, where he quoted, there has been a significant reduction in both footfall and income for hospitals and clinics since March 15 in the UAE. Now, according to you, what kind of tough decisions will healthcare organizations take in this situation?
Can you repeat the question? The end
I'll
of the
repeat.
question?
Sure, I'll repeat the question. So, Dr. Azad Mupen, he quoted that there has been a significant reduction in both footfall and the income for hospitals and clinics since this rise of COVID-19 from March 15 onwards of this year. So according to you, what kind of tough decisions will healthcare organizations take?
Can I start, Dr. Fadda?
Yeah, so I will answer the question. Okay, so yeah. See, also I mentioned in the presentation that the threats. Yeah, sorry, you will answer or I answer? It's up to you.
no, it's okay. You can start. I will continue.
Yeah, okay, I'll start. Okay, because also I mentioned this when I talk about the cabinet in UAE, Sheikh Mohammed bin Rashid, he talked about this. Now we need to restructure our plans and our strategies. And one of the main threats and challenges that we have is food safety, economic safety, healthcare safety. Okay, so the strategies and plans on the macro level, on the governmental level, should be focusing now on the food safety and the economic safety. Most of the countries, they remove lockdown. Why they remove lockdown? Because the economic is really it's under challenges, and people, they are striving, and they are it's a big challenge for them. So we have to think about this, because this is the basic needs that people have. The basic needs is the foods, and in the security, and the income, and it's the health. So that's why this should be in the main points to be discussed in the strategy. So once we are talking about the strategy of healthcare and the plans of healthcare, we are also including this food safety and economic safety for this. We are including about accessibility. We need people to access. How to access? We need also to support those who don't have commands for digital health and for the technologies. We need also to think about those, how the private sector and the governmental sector will work together in order to support those to have at this stage, if we are using the AI or remote, let's say remote services, to support them to have access to the technologies. So this is also this is my point of view about this.
Dr. Mila, your final comments?
Yes, I will just refer to Dwight Eisenhower, who said that plans are nothing and planning is everything. So I support the meaning of Dr. Fadda that we will have to change our plans, the way we plan things ahead. Our strategic planning should change, definitely, and that will lead to our tactics to change and our operations to change. So this would be on multinational, national, regional, and local level, and organizational level is also, because you should be in compliance. If you're a healthcare manager of a hospital, for example, your strategy must be in compliance with the regional healthcare strategy and with the national healthcare strategy, and nowadays with the global healthcare strategy. So yes, that's it. The change is constant.
Yeah, exactly. So the leadership is very important. That's why all healthcare professions that's attending and ask about what is this degree related, whether MBA or diploma in healthcare management and leadership, and the MBA in general. Those will support the leadership skills for those healthcare leaders, because now because in leadership, once you are leading, you will know how to allocate the resources and how you can respond and react for efficiency and effective outcomes at the end of the day.
Yes.
Thank you very much. Thank you very much, Dr. Milan, Dr. Jazla, for investing your time with us. I'm sure that our audience has learned a lot, have gained some informative knowledge on this one. So we're definitely looking forward for more webinars, and we'll be definitely looking forward for you both to be part of it. And thank you once again from Westford. And I would also like to thank all the audience who have joined us for this webinar. Thank you. If you have more questions, feel free to go to our website, drop us a query, and advisors would get in touch with you and will answer your queries. Okay.
And
Thank you, everyone, and stay safe.
Thank you so much. Stay safe. Thank you. Bye
Thank you.
bye.
Thank you, everyone. Take care. Bye, everyone.
Bye.
Bye. Bye.